Miss Nathalie Cain, also known as Dr. Nat, consultant plastic surgeon, specialist in upper limb and facial aesthetic surgery, international fellowship in cosmetic surgery, and faculty trainer for Mertz Aesthetics. Passionate about training the next generation of plastic surgeons to be better than she is. Welcome, Dr. Nat.
Thanks for having me.
Upper limb surgery and facial aesthetics to me seem like an unusual pairing. How did that happen?
Yeah, fair enough. And there's probably only a few people in the world, and they'd all be plastic surgeons, who would understand why the two link together. And you basically have to find a personality that's obsessive about the detail and somebody who likes complete variation from case to case. So the thing that drew me to hand surgery and upper limb surgery is the anatomy, essentially. So I absolutely have always, pretty much since medical school, been obsessed with the anatomy of the upper limb, right from how it forms in utero through to how it presents and how it ages and how the biomechanics change. But the other place where anatomy is notoriously fiddly, variable, and means that you have to adapt your operation or your non-surgical plan is the face. So I have always been interested in both of those areas from that point of view. And that's how the specialty developed. I was doing non-surgical aesthetics before I really positioned myself as an upper limb specialist in surgery. And it's the non-surgical side of treating the face has naturally flowed into the surgical side. So yeah, I think it underpins an obsession with anatomy, and both areas are super interesting.
Excellent. So your bio says you want to train the next generation to be better than you. And I quote, because I will want a bloody good facelift. So when did teaching become part of that mission away from doing it yourself?
So really early on in my career in medicine, I think I recognized that even as a medical student, you sometimes get made to feel like a bit of a hassle. So you're in the hospital, let's say you're in an operating theatre, you've got a consultant and an anaesthetist and a registrar and sometimes like 7 or 8 people who all have a clear role. And you as the medical student, you don't know whether you're allowed to scrub, whether you should stand back, what you should touch, what you shouldn't touch. And it makes you feel like, why am I here? How am I going to learn? And it's not an easy learning environment to be in. And then as I moved through my sort of training pathway, I realized that some people like to teach and some people don't like to teach. But I recognized how much it meant to me when someone who was already qualified spent the time and showed an interest in how I learn. And I also think that what I noticed was that the people that were happy to teach were often the really good surgeons. And I think it's because if you're going to position yourself as a trainer, it forces you to really stay up to date, because the people that are coming through are at the forefront of learning. They're reading more papers, they're training, they're really inquiring faster, younger minds. And I thought, yeah, that's where I want to be. I never want to lose sight of where the field is going. And then this concept of I want somebody to be better than me is something I feel really strongly about. So surgery, in particular plastic surgery, in my personal experience, it attracts big egos. And some people have got a bit of a complex about how they got there, because it's a brutal training pathway. And once they're there, they want to be positioned as the best person. They want to be delivering it. There's often a lot of money associated with it as well. And that doesn't create a great training environment. But if you, in your career, produce something fantastic, you have to look at why we're doing what we're doing. And we're doing it for patients. Even in the private sector, in cosmetics, you're trying to deliver the highest standard of patient care. Now, if I work really hard on myself for my 20-year career as a consultant or whatever it turns out to be, and produce great results for my patients, I'm going to have an impact on them. And that's going to be like a few hundred, maybe 1,000. But if I then disappear and leave and that's it, gone, and I haven't passed that on to anybody, then my perception is that all I've fed there is my ego. So I've gone, oh, Nathalie Cain, you trained really well in plastic surgery. You learned how to do this procedure, that procedure, the next procedure. And now that you're retiring, the service is dead, nobody knows what to do with it anymore. And I've seen that happen firsthand in public and private sector. Somebody that's really good just doesn't pass it on. So as soon as I became a consultant, I decided I'm going to make sure that I don't allow myself to drift into that sphere, and make sure that I constantly check in and say, no, I'm going to be challenged by the next people that come through. And I want them to encourage that and say, why are you doing that? Why do you do that like that? What have you thought about this? But I'm comfortable with that because I want them to be encouraged, and I want them to do better than me, because then we build something massive that means that what I discover and get good at benefits not just my patients, but the next round of it. And I think it really solidified for me as a consultant, but a particular experience made me think I need to be a trainer. So I actually failed the second part of my exit exam to be a consultant. So we do 2 stages in the UK. We do the MCQ, which is online, and then we do a practical exam. So it's 2 days of 5 as face-to-face. And going into the exam, all of my trainers were like, you're going to do great. We're not worried about you. All the practice is going well and all the rest of it. And I absolutely bombed. I failed. And I was the only one of 4 people that failed in my cohort. And so that was a difficult path to walk. But I think the way you react to stuff like that defines who you are rather than it happening to you. I think it's about how you respond. And it really helped me to, when I went forward, go, okay, obviously I need to get through this exam, but now I've made it my mission that I'll hold the baton in East Midlands for the person that failed the Part B, and I'm not going to pass it on. And we've totally revamped how we train in plastic surgery in East Midlands. We've gone much more small group focused, look at how that person learns, look at what's blocking that person from making progress. And I work with each trainee that's coming through our region who's coming up to the exam, and I'll say to them, like, I failed, these were the reasons. And when they're at practicing with me, I've developed ways of going, I think this is what you're thinking, I think this is what's stopping you from answering the question. But I really believe that if I hadn't failed the exam, even though it felt horrific at the time, and I hadn't experienced that like negative training experience, and I hadn't forced myself to check in and stop myself going down that ego route, I think all those things have contributed to me going, no, actually, this is not really about me. This is about why I've gone into medicine. And, you know, especially if you go into private and cosmetic, it's easy to lose sight of that because you can just wander off into the money-making system. But that's why, because I really mean it. It's not just some stupid Instagram bio. And I do want a good facelift. So I'm happy for the next 20 people to learn from me because it's about leaving it behind. I don't want these skills to die with my generation, and some plastic surgery skills, like you don't do them very often.
Right.
Yeah.
That makes sense. They do say the best drivers aren't the ones that pass first time as well. So that's
Well, I failed my driving test 9 times, so maybe I set the standard.
perfect. So the couple of other things that you said made me think of 2 things, which is the best people, sometimes they aren't the best teachers, but sometimes they really are. And I was thinking of, that thing, unconscious competence versus conscious competence, and having to teach. When I teach people, it's like I'm reteaching myself. So it's really good for me as well. And I love part of the working with my clients in that way. And the other thing, the other person it reminded me of, I don't know if you're interested or follow tennis particularly, but Novak Djokovic, who's broadly known as the best tennis player alive, said a really similar thing.
Yeah.
I know he's known for taking time to speak and help younger players, which is cool.
It's true, because when you're training, you run your day-to-day practice being unconsciously competent because you've reached that level, don't you? When I have someone training with me, I have to force myself to go back and be consciously competent so that I can articulate the steps. And it is tiring. It's harder to have somebody with you. It's a longer day, but you have to think about the impact you're going to have on more people.
But that goes back to the conversation we had before we started the recording, which is I was talking to you about the different ways you explain the same thing, depending on where the person is on their journey.
Yeah.
It's a whole thing, but it's really important, especially if you are, well, regardless of whether you're doing surgery for medical reasons or cosmetic reasons.
Yeah, definitely.
I want to talk to you about the flood of new injectable products right now and how you decide what's genuinely new versus what's newly marketed.
This is a really great question because having been in the industry for quite a while now, I have seen various things come back around. And sometimes it's as simple as a product got dropped by one company, the license got picked up by another. So you'll see exactly the same ingredients come around in a different bottle. And that is a red flag because if it didn't work for one company, it's unlikely to work for another. When you're trying to look at what's new, truly new, the only way to stay ahead of it is to go beyond what's being marketed, is to go into the white papers that are being published. And that was one of the reasons why I was really delighted to work with Merz when I got into the aesthetics industry a bit more, because they are very pro research. But you do have to stay in touch with what's being published in the aesthetics journal, what the key players and key industry players are looking at developing. And that's the beauty of being linked with a pharmaceutical company. You will know what they're trying to develop lab wise and what they're trying to produce. And you'll know their product history. You'll know what's gone before them. The main thing I have with it is you can look at one product that's been around for a long time and use it in a different way, and it does become a new product. So there's that kind of crossover as well. But for me, I often don't focus on what's new. I'll focus on what's working. And I'm actually not ashamed to say that I'm not a first responder for a lot of these things that come to the market. I think it's a real worry if a company markets direct to patients as well as direct to healthcare professionals, because you end up with patients who don't understand the indication, seeking a treatment that might not necessarily be right for them. And that blurs your moral compass as a cosmetic doctor, because they've come asking for it. It's harder then to go back a step and say, no, hang on, what's actually indicated here? Because you've asked for something just because it's new or it's on TikTok or it's on Instagram or whatever. So I try and stay ahead of it because I'll know from Merz what they're developing, and you end up picking up other publications, especially about all the biostimulatory products that are claiming to stimulate collagen. You'll know what's been published, what's actually got biopsy data backed up to prove that it works. But then the big thing for me is doing once you feel a product is safe, if it's got a couple of years of data behind it, and my God, it has to be FDA and MRHA approved for me to go near it. I think as a good aesthetic doctor, you have an obligation to do your own analysis before you start rolling it out properly. So I will always try a product in appropriately consented patients, and this is still a totally licensed product, and do it as per the protocol from the manufacturer, and objectively look at my results and go, did that actually work? But I'll always do that first. And it's led me to go down the route of discarding certain things that people are obsessed with on social media, because I cannot show it that it works in my hands. Even adapting protocols using different administrative techniques, I just will not do something that I don't think I can see and the patient can see an objective difference. So I don't necessarily mind whether it's new or not, because sometimes older products you can use them in different ways, but I stay ahead of it with the research, and then I check it myself and see who actually responds. And there are some products where you have to consent the patient and say 40% of people see no difference after this treatment. And that's because we're trying to stimulate biology, and everyone's biology is different. So you might not have the genetic marker that's required for you to get a response with this product. And you just have to be honest with patients. And if they're not happy to take that risk, I think that's fair enough, don't you? You wouldn't do many treatments where you say 40% of people see no results. That's £500, please.
What do you feel is the critical conversation happening in aesthetics right now that the public never hears? I feel like you were on the cusp of that, but the trends, etc., maybe the non-surgeon injectors.
So in non-surgical at the minute, I think most people who are in the field and staying up to date would say that regenerative medicine, and in a subheading biostimulation, is key. like 5-6 years ago, we were replacing volume loss in the aging face quite coherently with hyaluronic acid, and that was about it. And now we're asking for a lot more from our products. And it's a nice thing in a way, because a lot of patients have steered away from trying to search for this overfilled face to actually, what can I do to wind back the clock more authentically? And that's where biostimulation has come in. And biostimulation means any product that you inject which claims to have a tissue altering effect. So most products will hydrate because they're hydrophilic, so they attract water, but products that actually claim to stimulate tissue change, so whether that's collagen or elastin deposition or upregulation of positive growth factors in the skin, those are biostimulants. And what's happening now is that biostimulatory market is really being challenged both by patients and by aesthetic doctors and nurses, aesthetic practitioners, to create a proper anti-aging environment. So to actually wind the clock back, stimulate the collagen and elastin, but produce this really useful mix of growth factors and stimulation that gives you a more authentic age reversal process. So they're trying to, rather than mask the signs of aging, which is what simple volume replacement does, they're trying to actually reverse it by giving you a different tissue composition because of the product that you've had injected. That's the newest thing. And what you've got there is a market that's wide open, but because of what you're asking the products to do, there's a lot of place where regulation needs to catch up, because there's so many things out there that you can buy not from a pharmacy, to put it simply, which may have a role in the future, but there isn't much benefit to being a first responder in that respect, because now we're not talking about a new filler that may or may not need dissolving and may or may not have a good tissue integration profile. We're talking about something that is altering your cell biology. Now, what else does that? Like skin cancer alters your cell biology. Cancer is a thing that changes your cell signaling pathways. We don't need to rush into these products that claim to do that without proper safety data. But because the market's asking for it and it's being challenged, everyone's rushing to get to the ultimate age reversal product, and that's where things are. Yeah.
So to that end, what do you wish every patient client understood before they sat in the chair?
So I wish they understood that it's a journey. So a good result in non-surgical treatments should be a prescription that you put somebody on that's a treatment plan. And if you want to get the most authentic age reversal natural results, you have to address multiple layers of the face and over time in different ways. So there's a role for volume replacement still, and there's a role for biostimulation, which for me addresses the laxity because it helps things to tighten up. So you've got the laxity and the volume side of things, but it doesn't happen overnight. So if patients understood that they could get a certain result quite quickly, but then prolonged patients, you'll see so much over. Most of my patients see their peak result at 9, if not 12 months after first starting, and then they go on to a maintenance. So it's a real investment in their time and money. But then once they're on a maintenance, it's a very achievable option. And I think that's been a hard thing to articulate and change people's mindset on over the last couple of years. And the other thing is just realistic expectations. And that's really definitely 100% the medical professional's job to set those expectations. Because, and I think being a surgeon in the field, it really helps, because when a patient comes in and says, I just want to do that, this is my most common move, I know how much skin I would remove as in a facelift, and I know what a filler and a biostimulant can do by comparison. So I actually have now moved towards, when a patient does that, I'll say, oh, do you mind if I explain? Because what you've just done there, that's a facelift. And then I'll literally move their hand and say, that's what you can achieve with non-surgical results in the build up to it. And actually showing them, no, now you need to sit in the mirror and do that and think, okay, she told me I need to invest this much money and this much time, and this is what I can realistically achieve. But in order to set realistic expectations, it goes back to your products. You can't be using products where 40% of people don't respond and just hope that the patients are going to be all right because they thought you were a nice person, because then you can't set realistic expectations because you don't know what's going to happen. And that's why I'm fussy with these biostimulatory products.
Yeah, and the time thing is huge, isn't it? Because people want to just pay you and then walk out with the result, and there's almost nothing in the world.
Yeah.
It takes some version of practice. I just was working with a dietitian, and we were talking about, and we were working with the weight loss jabs.
Yeah.
And it's the same, it's a version of the same story. People are taking the jabs and it's getting a sort of a short-term win, but then it's causing some other problems around malnutrition and all of that. And actually, the partnership with her that we put together was with a pharmacist, because it needed to be the pharmacist in that town now is the ethical person, because that pharmacist is referring a dietitian out to all the people that, and it's perfect, because then it's like, okay, you've got this thing, you've got the quick win, but actually you want to stay healthy too, right? You don't just want to look, you want to be able to move and breathe and have fun and run around. You don't just want to be skinny, right?
Yeah.
And initially, some of them are just saying, do you know what? I just want to be skinny. But once the weight's gone, now we're talking about health as well. And so that partnership is amazing, because now the pharmacist is selling with confidence, and obviously the dietitian's got a waiting list forever, basically, which is fantastic.
That's how it should be, like, because medicine now, we have redefined the World Health Organization definition of health has changed, but health previously was like low down on old scale, Maslow's hierarchy of needs. It's right at the bottom, isn't it?
Yeah.
And we've redefined that now as doctors, and the World Health Organization says it's a all-encompassing thing. We're not just accepting that because my leg's not broken, I'm healthy. We need that whole diet, mental health, wellness, exercise, happy, fulfilled. That's health now. So you can't expect a GLP-1 to solve it all.
What's a GLP-1?
That's the injection, the
Right.
weight injection. Yeah.
Right. There you go.
Yeah.
So, an acronym health.
Can't expect it to solve it all. But sometimes people need to get over that hurdle before they can see, okay, now I do recognize I need everything. And the healthcare professional should be there to guide them into that, because it's bad medicine to just say, off you go. Yeah.
But it's practice as well. Like, my background before all of the stuff, before the book that I wrote, is music, and it's practice. And that's why I love working with you guys, because it's a practice. And so it's a great call out to say Maslow's hierarchy isn't quite how it is, because it's not once you're there, you're there. You have to keep practicing health, and sometimes that's annoying.
Yeah.
I felt this very morning at the gym. How do you say no to a patient? What's that conversation like?
There's two really definite scenarios where I have to say no. And the first thing I do is I check in with myself about whether I'm uncomfortable. And this really applies only in the private sector. In the NHS, it's a slightly different thing. You do still have to say no, but it's different. So it really has, you have to force yourself to understand when you need to in the private sector. So I'm in my clinic, I meet a patient, do a consultation, and they explain what they want, and I explain what's available, and I ask them what they like about their face, what do they not like about their face, what do they want to try and change. I have a conversation around budget, and I explain all the different options that I've got available to them, and I do that expectation setting. Then I wait for the feedback, I wait for the reaction. And if I think that I'm not going to be able to work with that person to get the results, it's a partnership. That's the thing, especially because everyone's on a journey. If they're coming to my practice, it's a partnership. And if I think, I ask myself this question: if you had the worst complication possible, because complications happen to everybody, if you had the worst complication possible of the treatment that I've just designed for you, would I be able to sit in a room, face you, say sorry, walk you through it, manage the complication with you, and see you out of the other side? Because that is a difficult thing to do. And if my spidey sense, and I say this when I'm training, if your spidey sense, which you learn in the NHS, to be honest, If your spidey sense says you'd be uncomfortable, then I will not put needle to skin, because I know that the relationship will break down because I can't help you if you have a problem. And that's where I've got to be. So then at that point, I'll say, okay, we've spoken about a lot today, and I want you to go away and think about it. I want you to have all the options available to you. I'll send you an email, I'll detail the treatment plan, or I'll write you a letter, and I want you to go away and think about it. And that gives me time to think about it as well. And then if the patient comes back, sometimes they'll have thought about it, taken it all in, and I'll get them to articulate what they want to try and achieve. And if I think the expectation is matched, then we can proceed. But if that patient comes back and I think I just can't get the result you want, then that's how I say no. So I say, I think what you want to achieve, I don't have the tools in the non-surgical environment to get you that result. And I don't want you to waste money, and I don't want you to be unhappy. And I don't want to have to manage that for you, because it won't be, you've come to try to make yourself feel better. If you then don't feel better, that's not right for me to pursue that. And the other time, and so then I don't have that happen very often, but the 1 or 2 times early in my career where I overrode the spidey sense, regretted it forever, because you know, and it's the same feeling that you get in the NHS where you think, oh, this is going to be a tricky person to deal with, because we're all tricky in some ways. It's the same feeling, and you can't override it in the NHS because it's different. But in private, you have to know, could you hold their hand through the worst complication ever? And it was a really well-known plastic surgeon that taught me that very early in my career, called Mark Henley. And that really has helped me to make those decisions. And the other time that I have to say no is when somebody's asking for something that is going to put them to the extreme of normal, or it's going to make their face incongruous. So if somebody's really focused on their upper face but won't treat the lower face, or it used to be lips, but it's not common for people to ask for that now. And it used to be like a really squared off jawline that everybody wanted. If they're pushing towards something that I think isn't going to use the products for what they're meant to do, which is anti-aging and facial rejuvenation, then I'll have an even more difficult conversation and say no. And in that moment, I have learned various ways to do it. I think when somebody's seeking something that's not reasonable, it's representative that there's something deeper. Why are they in your clinic? It's not because they just genuinely want to seek some facial rejuvenation. Someone has said something horrible. They might be going through or processing trauma, or they might have a really serious mental health condition. And I normally say, okay, I'm just going to say right now, we're not doing any injectables today. I'm not going to do it. I'm going to explain to you why. And actually, when I then spend the time saying to people, why did you actually come? Why is it that bothers you? And I'm going to have to ask you some personal questions, but we'll get to the bottom of it. You unmask all sorts of things. And that enables me to say no for a different reason, because I can say you're not seeking something that, in my professional opinion, is going to make you feel or look better. So I want to understand why you're asking for it. And there's the odd person who's like, well, I just want to be like that. That's fine. That's totally fine. But there are other doctors that may well be the person that can walk you through that, and that's okay. But I've referred several people, actually, and some with really sad stories, who needed support in a different way, but they were seeking the help through injectables. I think they're quite a vulnerable patient group at times.
Yeah. And I'm sure then you have relationships and partnerships and people that you know that you can say, I've got a friend or I've got a professional over there that you might want to speak to about this before we proceed.
Yeah, it's exactly what we have.
That's awesome. Okay. Let's talk about your new clinic in Nottingham.
Yeah.
You're running a full surgical list as well. What's the hardest non-clinical thing about building a practice that nobody warns surgeons about?
Yeah, so I've done it before. I've run a clinic before, and it didn't work for a variety of reasons. So this is second time round. The problem with surgeons is we're all highly driven, motivated people who push through, problem solve, and do all sorts of things. And there's 2 things that we're traditionally, especially doctors in general, but surgeons, I think, worse than most, not very good at. One is managing staff, and nobody at medical school teaches you how to do that. And the other is money. We're just not very good at it. And it's hard to make the transition from a public sector environment to a private sector environment, where suddenly you have to talk to people about the price of things, but then you have to also fight that overall instinct to give it away because you do have to run a successful business. And if you're not running a successful business because you're giving stuff away, I have to try and think the people that you employ won't be able to be employed. So if you can't make it the right decision for you, make it the right decision for the rest of your business to not give too much away. But yeah, I really struggled with managing staff in my first practice. And this time around, I have a completely different business partner. And I think we joke, but it's really only slightly tongue in cheek. I think he's the TISM to my ADHD at times because he's definitely got that skill set to manage things a lot more in a more structured, more kind of detailed way and get to the very bottom of the minutiae. And I've got the insight to say I'm not actually very good at that side of it, which I didn't have when I first had my practice. So we've taken a lot longer to choose our staff this time around, and we've gone through the business plan and the finances in far more detail, even though it's the most boring part from my point of view.
But it's essential, and certainly my experience. And here's the difference between me working with healthcare professionals in the US and here is that certainly in the UK, people feel like marketing and sales is maybe beneath them, or it's a dirty word, or because they've done all the training and they've ticked all the boxes, and that they're almost, why should I have to do it? Because look at who I am and look at what I've done.
Yeah, I see that loads.
Totally, because our entire culture is like, oh, we don't want to be salesy, but actually, everything that you said 5-10 minutes ago was about triaging the right patients in and showing and almost auditioning them, which is how I teach sales and marketing to people, is you're just filtering really strongly with your message at the top so you don't have to deal with wrong fit patients and clients. And then so you can make sure, okay, my favorite 2 questions, do you like them and can they pay? If it's a commercial thing, the challenge that I have helped so many clinicians with is, well, they came into healthcare because they want to help people. And I love those people because I want to help people as well, but not at the cost of their entire business surviving. And
Exactly.
especially if they've been in public sector for a long time, no one taught them that. And no one taught them that it's an essential skill to be able to message a market. So that's really cool. And it's great that you're going in again and you've got another partner who's got the complementary skill sets.
Yeah, I think it's hard because in surgical training, particularly in the UK, you're not taught to value yourself and your skill set as you come up through the top. It's a very oppressive education in many ways, which I'm obviously trying to approach it in a bit of a different way. But you do spend 10 years being told, oh, you're a bit rubbish, or like, oh, one day you'll get it. And then it's hard to then come into private and go, well, actually, I think you should pay me this much for this because I've been training for this long and I'm qualified to deliver it. And then it's balancing that with, okay, so you've done all this training. And then particularly when you start moving into the cosmetic sector, it's, yeah, but you're a plastic surgeon and you've done all this training, but what do you actually know about injectables? What do you actually know about cosmetic patients? Not everybody knows much about them. And what I've noticed, and I think it's been really good for keeping my ego in check, is like my patients, they don't fundamentally care that much about how I got to being qualified and good at delivering the treatment. They just care that the result is good and that if they're worried about something, they can reach out to me. And that crystallized for me when I was saying, I'm taking some time off because I'm doing my exams. And they were like, what exams are you doing? I've been injecting your face for 5 years. How do you not know what? I'm becoming a consultant. And I swear to God, about 70% of them said, oh, I thought you were a nurse. But are they bothered? No, they're not bothered. They're just bothered that you're delivering a good. It's really interesting when people come at exactly what you said, saying, oh, but I'm this qualified and I'm that qualified. Why do I have to market myself? Because everyone should come to me because I'm a plastic surgery registrar, I'm a plastic surgery consultant. But it doesn't work like that because it's a different patient group that have to want to work with you. Yeah.
So how do patients actually find and choose you, and how much of that at the moment is designed versus luck?
So when I had the practice before, we audited it and looked at our referral system because our patients were growing and growing. And we had this social media campaign and someone on the marketing and budgets galore. And we're like, right, for the next 3 months, we're going to look at our referral sources, because it's a button that you can click on the practice management software. And 75% of new patients were still word of mouth, even at that level. We were like, that's crazy. And we didn't potentially do our social media as good as what we could do now, but we found that the people that were coming through a social media ad setting and that sort of thing were much, much less likely to be wanting to commit to an appointment. They were more like send a few messages, send a few emails, but the word of mouth referral is still so massive for us. Yeah.
Any considered purchase, a TV is a good example, right? You go out back in the old days, you go and buy what hi-fi, what TV or whatever, and like, this is the one with the 5 stars that's in my budget. I'm going to buy that. And you get on the phone to your friend because you're going to buy the Samsung or whatever, and your friend goes, "Oh, I've got the Sony though. It's really good."
Yeah.
You go and buy the Sony like straight away. So that's so important. That's why I love a case study episode as a podcast. I love a consultant, a clinician talking to somebody they've worked with about where they were when they came in, what the process was like, and now how's it going? Like
Yeah.
that before, during, and after situation. Okay, people might find it, internet algorithm search, whatever. People might find it. But you know what? The patient will share it massively because
Yeah.
they'll be like, look at this amazing surgeon who helped me with my whatever it might be. They'll share it with their friends and say, you want to know why I got my nose done?
Mm.
Listen to this. You want to know why I got a facelift? Listen to this. And you can guarantee somewhere down the line in that social circle, in that network, your phone's going to ring.
Yeah, I agree. And then also the person that's been recommended by their friend, they come for the consultation at a much more trusting level
Yeah, you've
than
got nothing to...
someone. And then I think you do have that obligation to live up to that as well. So it helps,
Right.
it sets it within you like, oh wow, so and so recommended you to me. That's a privilege. That's something I feel really proud of. So I'm going to make sure I do an even better job of explaining everything to you, but then try not to give it away for free, because then we're back in the same cycle.
Yeah, hopefully you're not giving anything away for free.
No, not anymore.
What a great chat. Thanks so much. Tell me about the Nottingham Clinic and tell me where people can find you.
So our Nottingham clinic is ENIA, which is, we only just launched the name of it and all of the branding behind that. It's about energy and how energy devices, as well as biostimulatory products, as well as your whole energy as a human, impacts how you look, which impacts how you feel about yourself. And that's why our new clinic is positioned at Balance Health in Nottingham. And that is a whole healthcare facility that is not fully up and running yet, but it's almost there. They're a group of surgeons that have put together this whole facility where one floor is wellness. So you've got the highest end rehab gym, sports physios, pelvic floor physiotherapists, counselling, private GP, a coffee shop, the whole 9 yards. And the middle floor is a consulting floor. We've got half of that floor, or a couple of rooms within that floor, where we can deliver the highest standard in non-surgical treatments. There's operating theatres that can go up to a certain level of operation, but then there's consulting rooms where I think they've got 11 different specialties of medicine, secondary care providers that will consult out of there once all of their regulations have been met. So the reason that we positioned ourselves within that is because of this ethos that myself and my business partner, Jonathan Pollock, believe in so heavily, which is that it cannot be solved with just one injection. In aesthetics, it's a journey. There's multiple different things that you need to address. But we wanted to be at a place where if we picked up that someone is actually really upset about something, there's been so many times where I've had to go, leave it with me, I'll find the right person for you to speak to. Or they ask about something that we can't offer. So we wanted to be within that network. And I think what they're doing at Balance is really impressive. Like when it gets up and running, I'm not on the board of the whole hospital facility. I'm only in the plastic surgery side of it, but I'm excited to be in that space. And then from an education point of view, I'm mostly excited about what I'm doing with Mertz, because we're developing a lot of these anatomy training courses. And I think people learning their anatomy definitely makes you a better injector. And we underestimate the impact of that when you first start. I'm getting into the surgical side of it. So like cosmetics surgery, actual facelifts, I'm finally now booking, and that's exciting for me. And then overall, my other strand of life, the NHS job, I'm finally in my dream job at Derby, and that's a lifetime commitment. Yeah, it's really happy to have our new practice positioned at Balance.
Brilliant. How do I spell ENIA?
ENIA.
That's fantastic. What will the website be for that?
It's eniaclinics.co.uk, and then
Oh, Nathalie, thank you so much.
pleasure.